Welcome back. Let's Get Physical Therapy is an educational podcast brought to you by MedStar Health and hosted by me, physical therapist Becca Schumer. I will be sharing the mic with tons of healthcare professionals with the goal of educating and inspiring fellow PTs and future PTs. We hope you find this both informative and inspirational, ultimately optimizing how we treat our patients and grow as professionals. Please enjoy today's episode. Our guest today is Kristin Famiglietti. She's our regional director for the Southern Maryland region. She attended the College of William & Mary, where she received her bachelor's degree. She's got her master's degree from PT from Old Dominion University, and also holds a certification in vestibular rehab from Emory University. Kristin has earned her OCS, and when she's not in the PT clinic, you can find her picking up heavy things because she's a CrossFit coach too. Today we're going to talk about loading the older patient population, why we shouldn't be scared to. It's going to be a great conversation, and I'm excited to get into it.
Kristin, welcome to the podcast. How are you?
Thank you, Rebecca.
Yeah. I know we're going to talk about loading the older adult, and I'm just going to preface this with, I'm going to say athlete.
Yes.
Instead of adult, like 90% of the time.
And that's okay, because one of my quotes, which I know you're going to ask me.
Yeah, no, don't spoil it. Don't spoil it.
Yeah, I have other ones, though.
Okay.
So, is athleticism can be experienced across the lifespan, right? So,
True.
You're going to talk about athlete. We know we're talking about the older adult, but they're just our older athletes.
We're going to use them interchangeably.
Yes. Their
Cool.
sport is life.
Sport is life, for sure. All right. Well, before we hop into this awesome topic, I would love to hear about your own journey. How did you get into the field of physical therapy?
Yes, not, crazy exciting. Didn't have an injury as a being a teenager or anything like that. Just knew, felt like I wanted to help humanity. I saw both my parents sitting at a desk, doing something that made no sense to me as a young person, and I didn't want to do that. So just with exploring career options through college, started volunteering in a outpatient physical therapy practice. And my joke, which is really not a joke, but I was like, well, if I become a PT, I don't ever have to wear a skirt. So that's the career for me.
That's perfect. Not working at a desk and not wearing a skirt.
Exactly.
Perfect.
Perfect career for me.
Yes. Well, as we said, we're going to talk about the importance of loading the older athlete, adult, both. Yeah. And I would love to hear more about why is that so important not to treat the older adult as a fragile human being?
Well, I think sometimes they are fragile, right? But don't we want them to not be fragile, right?
Touché.
So I think it's important to take a self-assessment to see, are we treating these people differently than we treat, the teenager, the 20-something-year-old, the 30-something-year-old, the weekend warrior? How are we treating the older adult who isn't playing sports, isn't going to a job potentially, but needs to get out of bed and go to the grocery store and stay independent as long as possible? So I think it's we need to respect this population just like we would respect any other population. They certainly have deserved it and earned it.
For sure.
Yeah.
How do you define elderly? What does elderly mean?
So it's funny, I looked that up, and I think it's a term some psychological association doesn't like to use, right? What does define elderly? I think it's we can define the older adult. I think if you Google it, you're going to find 60-year-old or 65 or older. But I certainly wouldn't say 60-year-old or 65-year-old would be elderly by any stretch of the imagination. But I think if you're going to use that term, I think of more thinking in terms of where are we on the frailty scale, right? So I've seen a 63-year-old who acts and looks like she's 90, right? Because of her mindset and how she thinks she's old and she shouldn't be doing these things anymore because she's old, right? So I think a lot of defining who's old, right, is really about like, are they interdependent? Are they dependent now? Like, what is life like for these people? And that age is probably different for many different people, right?
Yeah, and probably more kind of what you're saying, like functionality versus like just a number.
Oh, for sure.
Yeah, like there's a lot of fear mongering when it comes to like, oh, they're older, they shouldn't be able to do deadlift squats, like we're gonna hurt them. And so we put the fear in these people, and then they start to avoid things, and then they get stiff, and then they get injured, and it's just this vicious cycle.
It is. I see so many patients that come in and some healthcare provider at some point along their journey has told them, "Oh, you have this diagnosis, right? Or you had this happen to you. You should never do this anymore. Whether it's lift more than 5 pounds, or you should never run, or you should, you know, never squat. Squatting's terrible for anyone." And it's like, but, healthcare providers, like, people take what we say, like, for truth, right? So we have to be very careful how we word things and what we plant, what seeds we plant in people's minds. And unfortunately, really detrimental seeds have been planted by too many healthcare providers out there. And I think it's part of our job, being physical therapists, to re-educate what we can. Sometimes it's not possible because these seeds have grown into these huge trees now in this patient's mind, and I'm not going to be able to chop that down by myself. So, one, I think as a healthcare provider ourselves, we need to be careful how we create fear in patients, and then two, understand that patients that are going to come in the door many times been educated probably inaccurately as to what they can or can't do anymore.
Yeah, those conversations are hard to have when your patient comes in and we know they have the ability to do X, Y, and Z. If they're like, my doctor said no, like, don't
Yep.
do it. How are you having these conversations to start to break down those walls?
So sometimes I haven't been able to, right? So you can get a quick idea if a patient has a fixed mindset or has a growth mindset, right? And I think if somebody truly is walking in the door with a very, very fixed mindset, no matter the age, right? That's really hard to tear that down and to start creating in a 60, 70, 80-year-old person, changing their mindset at this point in their life. Sometimes it's hard. So my goal with those people is to maybe plant a different little seed that might grow a little bit and help them in some sort of way. I was going to talk about this later, but I think part of what I like doing is bringing in joy to no matter who I'm treating. Particularly, I talk about it with the older adult because so many people have stopped for whatever reason, because they can't drive anymore, or because of their back hurts, or they're more prone to being unstable in their feet, right? They stop doing things that give them joy. So I do bring that into most conversations in physical therapy because we need buy-in, right? And what better way to buy patients in to getting more active and just maybe changing from a fixed mindset to a growth mindset a little bit is just pulling in, hey, what gives you joy? Tell me 3 things that give you joy. And we start talking, like weaving that in, that can affect how we care plan, that can affect how we educate them on community resources, all kinds of things.
I guess getting back to loading, as our topic is loading the older athlete or adult. See, I just did it there.
It's okay.
Like when you're in your clinic and a couple things come to mind. So you're in a clinic with patients that all look like you. Like say you're in a clinic with all older adults versus having someone in a clinic with athletes, like younger population and an older adult. How might that impact that patient and their willingness to participate or their willingness to try different things? Does environment matter?
So it's interesting because I haven't been able to create a certain environment for this patient, right? It's my clinics and where I treat, kind of treat a bit of the lifespan, right? So they're going to walk in the door and likely um, see patients of all different sorts of age ranges, right? They might, I'm in a smaller clinic, so it's not going to be jam packed with a lot of different kinds of patients necessarily at one time. So they might be in there with an athlete, they might be in there with somebody, who is in their 30s or 40s, or they might be in there with people that are definitely worse off than they are, right? Plenty of times I hear people, I see the other people in here and I don't even know that I should be here, right? And that can span, the ages. I'm sure you've heard that plenty of times. Um, I do like seeing, like, a lot of times your patients start talking while they're doing treatment. They're doing different things. They start to talk about their experiences, and I think it's definitely helpful to know that you're not the only person, experiencing pain or functional deficits, and to share those kind of stories. So it's fun when I see patients sharing stories, like your total knees, they're in there talking about their total knee experiences and how they're doing with this and how they're doing with that. So I don't really know if I can answer that question well because I'm not in a really sports acclimated facility, right? I'm kind of in your run of the mill outpatient orthopedic clinic that's going to see your teenager with, a knee injury or concussion, all the way up to somebody who's potentially 90 something plus years old, right?
Yeah, that's fair.
Um,
Getting into kind of the nitty-gritty of like what does it actually mean to load an older adult? Like what does underloading, like how's that a disservice? What does it look like to load an older adult?
right. So I think, one, would you be willing to add weight and add load to a younger patient, right? A teenager, 20, 30, 40 something year old. Are we comfortable doing that? I've been in clinics where I don't see that even happening, right? So I think we have to check ourselves. Are we doing this across the lifespan? I think every human being, no matter your age, we have to pick things up. We need to get up from a chair or toilet. We need to push things, right? Grocery carts, push heavy doors open. We need to pull things, and we need to carry. So I tend to try to check all the boxes, particularly with an older adult who's coming in for no matter what reason. I tend to check all of those boxes for all of them. If they're coming in for a shoulder injury or back pain or imbalance or stroke or whatever it is, those people still need to do all those things. So just because you're coming in for a shoulder, like, I'm still going to make you lift because you've got to use your arms, right, to lift something off the floor. You still have to carry things. And then obviously you can pushing, pulling, pushing overhead, reaching overhead. Those things are easy with that you're going to incorporate with a shoulder patient. But don't forget, I try to talk about all of those things no matter why the patient's coming in, right? And have them demonstrate, because you can justify that in your plan of care really for any diagnosis that's coming in, right? Our job as a physical therapist, we've got to create appropriate goals, right, that make sense for why the patient's coming in. But a lot of times that can be very all encompassing. So why do we have to load the older adult, right? That's what you asked me.
Yeah.
Reel me back.
No, it's all good. For the potential physical therapy students listening in,
Yes.
like we've been in this field for a long time. I know what this looks like, how to load an older adult. But what might look different, like if you have someone with a walker with a cane and they still need to carry things, how might this look in your clinic? Might like different equipment? Are you using different things? Like literally
Definitely.
what does it look like when you're loading an older adult that might look a little different than a 15-year-old athlete?
So pulling back to that, so I know what you're getting at, and I'm gonna back up just a second, because sometimes they're very, like, you're starting with, oh, my doctor told me 20 years ago I should never lift more than 5 pounds, right? So a lot of times you're starting with education. A lot of times you have to get them to understand why, then talk about what they're doing in their life now. They're probably doing that or more now with what they're lifting in their laundry basket or groceries or things like that. So starting with education, and then a lot of times we have to just create little wins, right? I have so many older patients are like, I want to hand them 2 8-pound dumbbells, right? 16 pounds, like what? They're like, I can't carry that. And I'm like, you know what? I think you can, but I hear you. And I just start with something lighter, right? Just get a win, show them they can do it, and it wasn't that hard. And then you can start to add more load from there. And they're like, oh my gosh, look at what I can do. I can carry this. And then I remind them, remember when you didn't think you could do that? Look how easy this is. And you're doing so much more than that now. So I think first, sometimes we have to start smaller than we'd want to. Sometimes they haven't been doing a lot of things. So we need to consider how they might feel, after loading even just a little bit. Explain muscle soreness, right? And then normalize that for them. And then what might look different? So obviously, there's so much. I can't talk about all of it in our podcast here, but say you have somebody coming in that is ambulatory, that's walking with a walker, for instance, for now. I might hang weights over their walker and have them push and pull their walker. A lot of times I could have somebody else help me guard the patient, and I can use a cane or a dowel, and I just use myself, right? And they hold the dowel and I hold the dowel, and I get into my stance. I'm like, push me over, right? And I tell them to walk and push me, right? And I think that's super fun. Say somebody is sometimes in a wheelchair, right? You can have them put your clinic assistant in the wheelchair and have them push somebody else in the wheelchair, or put load or weights in the wheelchair and have them push or pull the wheelchair. So that's something that might look different. If somebody uses a cane, you can incorporate their cane into, like, hook a band around it, and you can do deadlifts from the floor, like, with the band around the cane, or just incorporate the cane and over, like I do overhead presses a lot, right? So they might use the cane with different press or pushing or pulling activities. You can do stuff in sitting, right? So if somebody doesn't have the balance to stand up and do a deadlift, right, you could have them sit, right? You're working on hip hinge, but again, that might not look perfect. We're not looking for perfection, I think, as a side note, like, but you can have them lift from a seated position. You can have them sit on the edge, hold heavy weights in their hands, and march and sitting, right? So they're getting good grip strength. They're getting some endurance there. So those are some things that might look different. Oh, you might have to change the range of motion, right? So say somebody doesn't have the mobility to lift that it looks really safe from the floor, just move the floor up, right? I've gotten creative having people practice things at home, like a propane tank. I've used that, right? It's higher and it's a little bit of load. It can be changing load, decreasing load over time as you're using it. But, you can get creative and teaching people what they can use at their house. So it's a little bit higher. There's handles on it. I've used that for elevated deadlifts, Does that answer your question?
Yes. You're so funny. No, that's great. And I mean, the possibilities are endless. I feel like as physical therapists, we're typically creative people that can figure out how to get the job done in one way or the other. So I'm thankful.
If you're less creative, ask the OTs around you. I have definitely learned some creative strategies from occupational therapists.
There you go.
Yeah.
And, two things came to mind as you're talking, and I'm sure we can get into both. But one, we had to meet our patients where they are. So even if we know they're capable of doing so much more, if we push back too much when they're expressing their concerns, then we're not going to get anywhere. So
Absolutely.
A, meeting the patient where they are, and then B, something I'm sure we'll get into as well, is just the lifts and the exercises might look a little different in this population, and that's okay. We have to understand the range of motion deficits, and that's okay as long as they're maintaining good form for themselves within their available range of motion and it's not painful, then it's okay if it looks a little different. You can still get the job done.
That's right. Yeah, and a lot of the fear I think in therapists is spinal neutral, right? Like,
Yeah.
so if we're gonna have somebody lift, like we want their spine to look a certain way. And a, 75, 80-year-old little lady, I've had so many like kyphotic spines coming in. We really just want to make sure we're not increasing that, right? So as long as they can maintain their neutral posture cut, which is a kyphotic posture, super forward head, right? As long as that's fairly consistent as they lift, then it doesn't create pain and all of those things. I'm going to assume that we're assuming that.
Yes.
all of this.
Yes.
Then that looks different than like somebody than I want to look when I deadlift. But this person can no longer achieve what we spinal neutral, a neutral spine position. So we need to think about, do we want this lady who likely has osteoporosis and maybe has had some history of fractures? A lot of times that creates fear in the therapist, right? I don't want to fracture this person. And of course, we don't want to fracture this person. But what is safe, right? So is it safe to let this person continually decline and become more and more frail and therefore more likely to fracture? Or is it safer to gradually, progressively load? So we're creating that increase in strength. We can work on some power, maybe create some improvement in, bone structure. So what is one, I would argue that it isn't safer to say, you know what, let's just let him or her get more and more frail and therefore less and less independent.
That's a great point. And I'm thinking about the same principles that we use for any other age still applies to this population. So we need progressive overload, and we also need to work on, power, strength, endurance.
Yes.
All those things. When a patient is about to go for when they're about to fall, then we need to react quickly, right? So how do you practice those kinds of things in the clinic for someone who's more of a fall risk?
Yeah, so one thing I definitely wanted to talk about was working speed and power, right? So that was one of the things I wanted to bring up was in balance reactions, we have to react quickly. So
I read your mind.
You did read my mind. It's on my notes. You read through the computer, you read my notes, Becca. So I think it's important to not just work, okay, well, we're going to do these static balance exercises and we're going to do these dynamic balance exercises. All great and all things we should be doing, but how are we working on their ability to react quickly? So I think it's important that we're making sure we're trying to work on speed and reaction time as well. So you can work on speed with any exercise you would be doing, right? You just change it and say, okay, now do it fast, right? That could even be, I know doing TheraBand retractions, right? Like not necessarily going to help me with my reaction time with balance, but just as an example, if they're doing regular rows or retractions with the TheraBand, a lot of times we're having them hold or pause and then come back, right? And hold and pause and then come back. But what about doing that fast? Like do the slow ones for strength, but then how about like doing that same band or a lesser resistive band, but doing it fast? Just to remind myself, right? Because I'm years out of being in school, right? But power, just to remind myself, I looked this up, physics a long, long time ago, is work over elapsed time, right? So say you have a patient moving 10 pounds over 1 second, right? That's whatever the unit is, watts. 10, right? 10 watts maybe. Don't quote me, guys. But say if you had them do 10 pounds over half a second, right? 10 divided by point time, 0.5 is now 20, right? So now you've just by increasing the speed of that whatever activity that is, you've now had them work on improving their power, right? So you can think about that in any aspect, whether it's an upper extremity activity or lower extremity activity. I think it's also important to work on dual tasking, because a lot of times we're so focused, like we're very one track minded in therapy, right? When we're working on balance. But in life, there's distractions, right? There's people walking by, if they're in a parking lot, there's cars going by, and all sorts of people talking to you, and you're turning your head really quickly. So we also need to incorporate dual tasking and making sure that we're changing the environment and making it distractive while we're working on these balance tasks or power tasks, right? So that it is more, there's more carryover to their daily life.
It's important to drive home the point that if we don't train these other variables, then how can we expect our bodies to pull from those in the moments where we need to fast? So just doing 2 sets of 10, 3 sets of 10 at the same pace over and over and over again.
Right.
It's not gonna help them when they're falling over.
Yes, and I get nothing for talking about these things that I use in the clinic, but I like using blaze pods, right? Because and patients love it. It doesn't matter how old or young a patient is, they have so much fun with the blaze pods. It's like I say, it's like PT whack-a-mole. But they love it. Like teenagers love it, and like 90-year-olds love it. And they're quickly trying to create these reactions to hit the colors right when they pop up. You can create some distractions in that. So I really like using blaze pods to work on dual tasking, to work on quick reaction. I found that to be really helpful.
I know for this, it's going to depend on your patient and their abilities. From a home exercise program standpoint, when you're working on these things, how might that look for an older adult when you're trying to load and all of that? Are you giving them these things to do at home? Would you rather them be more under supervision? Does it depend on how they look in your clinic?
Yeah, obviously that's
so many variables, right?
Yeah, of course. You know that.
I know.
No question.
I'm asking and I know the answer, but go ahead.
I mean, so one thing we have to consider is there any amount of dementia on board, right? That creates a whole nother host of complications with how we interact with this patient in the clinic and what we can expect at home. So I've seen patients who do super well in the clinic, right? Then they get discharged. And then 6 months later, they're back in the clinic, right? And I'm like, okay, well, what have you been doing at home? Oh, and, patient and family is like nothing, right? They're not doing any of what you gave them at home. And I think that's where you have to come back and really figure out what does the patient want with their life, right? And potentially, if it's a very, very older patient with the rest of their life, we might want them to keep lifting and we would want them to be independent. Sometimes patients don't really care. They're like, I'm fine if my daughter has to pull me out of bed. Like, I'm okay with that. And, I do the best I can to try to reframe like what life could look like. And again, it's that, where is this person's mindset at this point in their life? And to get back to your home exercise program question, yeah, that's a huge depends, right? So I think I incorporate a lot of conversation about community resources. I really push getting active in the senior centers and the area that the patient lives. I'm fortunate that we have multiple senior centers around where I live and treat that have all different kinds of classes every day, right? And so I print these things out. We look at them, see what might be interesting for this particular patient. Some patients like, I don't want to be around other old people. And so that doesn't look like a good option for them. But sometimes that's really helpful because they get the social aspect. They other people then start to hope that they see them, every Tuesday and Thursday, right? So I think figuring out what the patient's goals really, really are, what kind of mindset are they in? What makes this person like, what's going to be interesting and create some joy for this person for them to do, right? So not everybody's going to discharge from therapy and keep deadlifting at home, right? Like most younger people don't do that, right? So I certainly can't expect all of my older adults to do that as well. So I think it's really just, we're as PTs, we're investigators. So I think we have to think about what is going to stick, right? I had a patient just this week, I was starting to ask her these questions and about the resources in the community. And she's like, well, I really, really like doing the aerobics in the pool before. And, like as a PT, there might be some aquatic therapists listening in, and no disrespect, but it does unload, right? So being in the pool does unload us. It is a little less functional to daily life. But you know what? If this patient is going to go and move and get out of her house and go enjoy an hour of exercises in the pool, then that's what I want you to do. And I probably will give her some other things that, hey, do you think like a couple times a week you could do these at home? Sit to stands. I give almost every person like, hey, after every meal, I need you to stand up and sit down from your chair. Obviously, they have the ability to stand up and sit down. After every meal you eat, you need to do 10 of those, right? Forever, right? Just to keep that, right? So little things like that, maybe you can get them to do, but you also need, like, they're not going to have dumbbells or barbells or various equipment at home. So again, like if you really wanted them to lift, figure out what they have at home. Anyway, but you have to decide what's actually gonna stick and what isn't, right?
Do you feel like as time goes on, like people are more active, so you're seeing much more active older population, and maybe they do have access to these things and are doing higher level activities anyway?
Well, some are.
Yeah.
I would say the patients that I see in my clinic probably are not the ones that are necessarily already going to the gym, but I do see that more. And I'm a CrossFit coach, right? So I also, at my CrossFit gym, we have athletes that are for sure in their 60s doing phenomenal things, right? And so those definitely are your older athletes, your masters athletes. But there are a lot of opportunities with local gyms.
Is there anything with regards to loading the older adult / athlete that we didn't cover that you're itching to talk about?
Oh, let's see. I think you need to consider, the mental, like, where are we on the, is there dementia on board? Is the mindset, or do we have a fixed or growth mindset? I think pharmacology. So this is an area I'm not super, I'm not an expert in, but I think we need to understand that a patient who's on a lot of medications, and unfortunately, the older we get, we tend to see these long lists of medications. That's a whole nother, you should have a talk about that with someone. But I think there's so many side effects from the medications. I think that plays a part into, dizziness and imbalance and things like that. So we just need to be aware of those things. This isn't just about loading, but the other things. So I try to talk to everyone about not just moving and loading, but also sleep and how important restorative sleep is, and also healthy food choices, right? Because we as physical therapists, I mean, that all those topics are part of your physical being as well. So the last thing I think I probably wanted to cover was just nutrition, very briefly. Again, I'm not an expert, but most of the time, as from my observation with the older adult is that food tends to start tasting more bland and they stop eating as much protein. So I'm just going to talk about protein. That I think is the one other thing I wanted to talk about. Over 60, our protein consumption should actually increase. And in general, it probably, for most people, it actually decreases. So again, I'm not an expert, so don't quote me on these things, but I think protein consumption as a regular adult, right, under, let's say, an adult under 60 is about, and obviously this depends on your activity level, like 1 gram of protein per kilogram of body weight. And so if I tell an older adult, like if I start to talk about nutrition and I start to talk about protein and I say, hey, now that you're over 60, you really need to be consuming around 1.2 grams of protein per kilogram of your body weight. Like, okay, great. That's not going to mean nothing to my patients, right? So I think we have to, I will say, okay, like I'll get a patient's weight, I'll convert that to kilograms, I'll figure out like, what does that mean in grams of protein? But then that is very vague to patients, particularly older adults. So I spend a very little time. I probably could spend more. But how many grams of protein is in 1 egg, is in 2 ounces of chicken, is in, whatever they're eating, right? And I can calculate if they're like, oh, this is the protein I eat in a day, and I can figure out like that's like 30 grams of protein, and you weigh 160 pounds, which is 72 kilograms. I wouldn't go through all of this. You need 86 grams of protein, right? That's a big disparity. So I think starting some education on nutrition, I believe, is in our scope of practice. That doesn't mean our entire hour is going to be devoted to nutrition, but maybe I'm pulling in, I think we're really great as being the connectors. So maybe then I'm pulling in like, hey, you're really under consuming protein. Here's these nutritionists, these dietitians in the community. I really recommend you hooking up with one of them just to start some conversation there. So I think that was the only other thing I wanted to mention, is that I think just as physical therapists, we're looking at not just exercise, but we're also talking about sleep and nutrition.
For sure. Because if we're doing all this hard work with our patients in the clinic and they're not supplementing with good sleep to recover and good nutrition to build the muscle, then what's the point?
Right. Absolutely.
Cool. Kristin, this has been an awesome conversation about loading the older adult/athlete. Where can people find you? Where are you treating out of? And you know what? Back up. I need to ask you your favorite quote. What is your favorite quote? What moves you, drives you, inspires you?
Well, one of my favorite quotes is from Brene Brown. It's just, the comparison is the thief of joy. And that's just something I use in not just my personal life, definitely my professional life too. But I'm not going to go into all the details there, but I do find that coming back to that from different times in my life, whether I'm comparing myself to other physical therapists who I think are better than me or more talented than me, right? Is just coming back to, this isn't about how I compare to other people or how my patients compare to other patients, right? And so just bringing it back, just a little self-check there. And then another quote, a little bit more aligns with the conversation today. And being someone who does enjoy CrossFit, this is more of a CrossFit definition, or quote, but athletes' needs differ by degree, not kind. So when you're looking at a 15-year-old athlete, that's in high school versus a college level athlete versus a professional athlete versus your weekend warrior versus your older adult whose sport is life, right? The needs are not different. We just have to alter them or scale them a little bit differently too, depending on where, how much or how little that person is doing in their life.
Yeah, I love that. All right.
So.
Now, where can people find you?
Yes, that is ever changing right now. So I am a regional director over in St. Mary's County and Charles County, Maryland. So my home base, I would say, is out of the Hollywood location, but I've treated a little bit in Leonardtown, and now if I'm helping out up in the Waldorf and White Plains locations right now. So it's a little bit hard to find me these days, but
You're everywhere.
Scattered around.
Well, once again, thank you for your time and for chatting about this topic with us.
Well, I appreciate you having me. Thank you, Becca.
Thanks for listening to the Let's Get Physical Therapy podcast. Be sure to subscribe to our podcast and follow us on Instagram at MedStar Health PT. If you've enjoyed today's episode, please give us a 5-star rating and leave a review so we can reach more listeners just like you. As always, we appreciate your time and hope you join us for our next episode.